Today we are going to discuss about the topic hospital-acquired infections. Hospital-acquired infection is also called as nosocomial infection or healthcare-associated infections. Approximately 10% of patients who are admitted in the healthcare centers have a chances of developing such infection. This increases the burden of morbidity, mortality and cost to the patients. So nosocomial infection can be defined as infection acquired by the person in the hospital manifestation during hospitalization or after discharge. The person may be a patient, hospital staff or the visitors. So in the past this infection were called as hospital acquired infection. However, it is now recognized that such infection may be acquired at any facility. The name has been changed to healthcare associated infections. The pathogens that are responsible for causing such infections are bacteria, virus and fungus. These microbes vary depend upon the patient population, medical facilities and even differ in the environment. So first we are going to say about is bacteria. Bacteria are the most common pathogen responsible for nosocomial infections. Some belong to natural flora of the patient and cause infection only when the patient's immune system goes down. The first bacteria we are going to say about is Actinobacter. It is a genera of pathogenic bacteria which is responsible for causing infection in ICUs. It is usually present in the environment. Around 80% of infection has been reported by this bacteria. Second we are going to say about is Bacteroides fragilis, which is a commensal bacteria found in the intestinal tract and colon. It causes infection when it combined with other group of bacteria. Third we are going to say about is Clostridium difficile, which causes inflammation of the colon leading to antibiotic associated diarrhea and colitis, which occurs mainly due to elimination of beneficial gut bacteria. Fourth we are going to say about is Enterobacteriaceae, especially Escherichia coli and Klebsiella are responsible for causing nosocomial infections. Fifth we are going to say about is methicillin resistant Staphylococcus aureus, which is widely present in the hospital environment and it is highly resistant to several antibiotics. MRSA transmit through direct contact, open wound and contaminated hands. It causes sepsis, pneumonia and surgical site infections by traveling from organs or bloodstreams. So next we are going to say about is virus. Around 5% of nosocomial infections are reported by virus. They can be transmitted through hand-mouth route, respiratory and fecal-oral route. Hepatitis is a chronic disease caused by the virus. Healthcare workers can transmit hepatitis virus to both patients and workers. Through unsafe injection practice, hepatitis B and C are transmitted. Other viruses include influenza, HIV, rota and herpes simplex virus. So the next we are going to say about is fungus. So fungus act as an opportunistic pathogen. It causes severe infection in immune compromised individuals. So Aspergillus species, Candida albicans and Cryptococcus neoformans are well-known fungal pathogens responsible for nosocomial infections. Aspergillus species can cause infection through environmental contamination. Candida albicans and Cryptococcus neoformans are also responsible for infection during long hospital stay. These infections are difficult to diagnose and cause high morbidity and mortality. Modes of transmission. The patient who are admitted in the healthcare centers have a chances of developing this nosocomial infection. So from the healthcare centers, the patient acquired the infection through aerosols, oral route, direct contact and parenteral route. So now we will say about some common types of healthcare associated infections. Urinary tract infection usually occurs with indwelling catheters. The agent responsible is Escherichia coli, Proteus, Pseudomonas aeruginosa and other gram-negative bacilli and Enterococcus. So mixed infection is very common here. Next about surgical site infection, which occurs during post-operative wound. The agent responsible is Staphylococcus aureus, Streptococcus pyogenes and Clostridium species. So next respiratory tract infection, which occurs due to pulmonary ventilation or instrumentation, may lead to nosocomial pneumonia, particularly in those with pre-existing cardiopulmonary disease. So multi-drug resistant Staphylococcus aureus and gram-negative bacilli are the common pathogens. So next we will say about is bacteremia, commonly caused by infected intravenous cannulae. The agent responsible is Escherichia coli, Enterococcus and Candida species. Acute gastrointestinal tract occurs due to prolonged use of antibiotics like fluoroquinolones, cephalosporins and penicillins that leads to antibiotic associated diarrhea. The antibiotics suppress the normal gut flora that leads to overgrowth of Clostridium difficile, which secretes the exotoxin that leads to fluid secretion, inflammation and tissue damage. The next infection is hepatitis B and C, which usually occurs due to blood transfusion or renal dialysis. Now we will see about the type of infection, risk factor and the prevention method. For urinary tract infection, the risk factor is catheters. So catheter care and appropriate types of catheter should be used during long term. And surgical site infection, the risk factor is due to prolonged surgery and surgical drains. The prevention method is surgical prophylaxis, proper wound care and dressing. Respiratory tract infection, the risk factor is due to ventilator or tracheostomy. So ventilator care and respiratory physiotherapy is needed. For bloodstream infection, the risk factor is due to central or peripheral lines. So proper preparation of the insertion site and care during IV lines is very important. For acute gastroenteritis, occurs due to prolonged antibiotic therapy. So short duration of therapy is needed. Now we will see about what are the risk factors in hospital acquired infections. Crowded hospital conditions, emerge of new microorganisms, increasing number of people with compromised immune system, increasing bacterial resistance and resistant to disinfectants. Now we will see about various methods used to control the hospital acquired infections. So reduce the microbial population of the hospital environment plays a very important role. Eliminate the danger of transmission of microorganism from one individual to another. To avoid cross-contamination, manage equipments and other inanimate objects to prevent them from becoming a source of infection. Practice safe method of biochemical waste disposal. Standard precautions has to be maintained in all the healthcare centers to prevent from nosocomial infections. Hand hygiene, respiratory hygiene, personal protective equipment, injection safety, medication storage and handling, cleaning and disinfection, and waste management. All these standard precautions are very important to avoid from the healthcare associated infections. Thank you for watching.